Hi everybody, my name's Lauren, and this is Terry
TJ.
Feazel. We are coming to you from our house to get to know you guys and to get some information out there about something that can happen a lot more commonly than people really understand. So, TJ, what happened to you?
I had a stroke.
Yeah, he had a stroke at 35, and we were completely unprepared. So our hope is that by getting some information out there to people, maybe it won't take so long to get diagnosed. There won't be so many complications because people will have the knowledge to know what we didn't know. What type of stroke did you have?
I had a hemorrhagic stroke.
And what type of area was it in?
Near my cerebellum.
Good. Near the cerebellum, yes. So we knew a little bit about strokes before this ever happened. Well, I did a little bit. You know, the basic things that we all learn. You're checking for facial drooping. You're checking for changes of mental status. You're looking for one side of the body having weakness, tingling, numbness. You have these dramatic things, and a stroke happens instantly. I mean, it is so fast. It is so dramatic, the changes in somebody that you love, that it seems like, how could that be missed? Unfortunately, we were like in the mild percentage of people that have this type of stroke that he had. And those symptoms were not things that our doctors and the medical professionals we dealt with originally had any idea about. It wasn't something they were looking for. It wasn't something they were checking for or even considered a possibility. So, what was your first symptom?
Dizziness.
Dizziness. To give you the quick version, we were out on the porch. He got ready to come inside to get something and reached out and grabbed what he thought was the doorway to catch himself. And I saw him start to fall. I grabbed him and asked him what was wrong, and he had most of his weight on me at that moment. He said he was dizzy. He didn't feel good. I said, did you get too hot? Are you okay? And we ended up inside. He laid down and he started vomiting almost immediately. And what occurred next was what I thought was like a 24-hour flu, because I was married to the man who never got sick. Ever. This man, I mean, how many sick days did you take in 10 years? 0. Very, very, very few. I think he pulled his back out once, would have been the extent of it. So, I had no idea what he acted like when he was sick, because he hadn't really ever been sick. So I was thinking, well, maybe he's just being a man baby. And I just, put him to bed and tried to watch him. But by that evening, I knew something was wrong. He couldn't walk across the room. He couldn't stand up or balance. He said the room was spinning. Every time he moved his head, the room was spinning. And so we went to the first hospital. And we were there for several hours. I mean, 8 to 10 hours of treatment. And they found high blood pressure but missed everything else. And there were quite a few things to find. So that's what this video is about. It is about showing you what you can test in somebody that you are suspicious of their behavior. Something crazy has happened. Vertigo is it's rare for strokes, but it is common for this type of stroke. So even if they're passing every other stroke evaluation test, but they're not walking across the room correctly, this is something that I want you to check, because it is just so important. If we had known, maybe I would have done this. Maybe I would have mentioned more to a doctor. So what you're looking for is you've had somebody in your family or in your life that their ability to walk across a room has changed. Where's your cup, babe? Has changed. And you'll notice throughout the video that he may stop and put a cup to his mouth. What it is that one of the issues that you can have after a stroke is inability to swallow. So we actually had a very severe time with this, where he had aspiration pneumonia, a trach, a lot of different things because of that. But what he's doing right now is that as he goes to swallow his spit, it doesn't go all the way down. So he has to bring it up through his mouth and cough it out to make sure he doesn't get too congested. So that's what you'll see. Nothing weird about it. He's all good, right? You still happy?
Yeah.
Yeah. So, we will not make you feel bad or anything, right? Right. So, yes, the things that you are looking for, your family member starts acting funny. They will have vomiting, vertigo, inability to walk or stand. They will lean to one side. There are also symptoms that he had that I didn't even know about. I didn't even realize till months later that they were related. So what you want to start with is something's changed. You know that. You're going to look at risk factors because that's what any medical professional is going to do, and it's good to be able to notify them of those risk factors when you go into an ER or you call an ambulance. If your loved one has hypertension, which is high blood pressure, if they have diabetes, and even if they're well controlled or if they're not, both of those can be risk factors to having a stroke. If they are overweight is another thing. And TJ at the time was minimally overweight, so he could have been on the borderline of any one of these issues. If your loved one smokes or drinks, you want to notify them. These things are not there to say this is your fault. These are things that can help them get to the correct diagnosis faster. So those are the first things you're going to look at. In his case, if I were to go back and look at those things, I would say his blood pressure normally was borderline. He was pre-hypertensive. So that would be something I would notify them about. He was not diabetic. He was barely overweight, if at all. He weighed 189 pounds. So really not, but at the same time, probably at that top scale, because he's not too tall. Sorry. So those are things that I would have notified them about. That's the first step. Second step is to check the functions of the cerebellum in this type of stroke. Now, this is saying that you know something is wrong, but it's not the droopy lip. It's not all of those other things. So this is the next step. So why don't you look at me? So the first thing you want to do with your loved one is check their motor reflexes skills. So the cerebellum will control their ability to perceive and reach out and touch. It's the balance center, kind of. So you can stick one finger up, and you're going to ask them with each hand at different times to touch their nose, reach out and touch your finger, and come back to their nose. So why don't you do that now? Touch my finger, touch your nose, touch my finger, touch your nose. Other hand. Finger, nose, finger, nose, finger, nose. Good job. So if your loved one is suffering from what he was, we'll show you what it looked like when we finally got this tested 48 hours after his stroke started. So, finger. All over the place.
Well,
And it can be disconnected on one side of the body, but not the other. So don't throw it out if it's only one side. That's normal. Because in his case, he was getting it on the left side. He was able to touch my finger, touch his nose, touch my finger, back and forth all day long. But he wasn't able to do it with his right side, where he ended up having some issues later. So keep that in mind. Next thing you're going to check is their eyes. So what you want to do is put your finger in front of their eyes. You're going to follow my finger, not the phone. Okay? And you're going to move, keep your head still, and just follow with your eyes. You're going to move your finger and have them follow your finger. So to the right, to the left, and back and forth. And right now you see he's one fluid motion. That's perfectly normal. That's what everybody should be. But in the case of a cerebellar stroke, his eyes will kind of twitch as they go across, like a cuckoo clock a little bit. And they will try to go that direction. They will go the correct direction, but they will do it in small spasms. That's a huge sign of this kind of a stroke. Big, gigantic, ginormous sign that we missed completely until, 48 hours in? And by that point, his eye was not only just doing the little twitches, it was stuck. One of his eyes was stuck on the other side. It was just like this. And so they put a patch on it and it got better over time. But point is, you're going to follow my finger. Now with TJ, it was weird because he had this thing as a young man when we first met where he would twitch his eyes. He'd look at you really, really close and then like twitch his eyes back and forth. Yeah, it was he knows. It was really freaky. So that's something, if you've seen it before someone do it, that's what you're looking for, is that type of little twitch. Another thing that you want to check is have them put their arms like this in front of them. Okay, on top of each other. Kind of like that. Yeah. Or you can hug yourself like you were just doing. I'm showing you both ways. Okay? And you want to sit up, not leaning up against the back of the chair, on the edge of the chair, and you want to see if this person is going to stay sitting steadily without swaying from side to side, leaning forward or leaning back. That's something that he could not do under any circumstances. Part of it is he said he was tired all the time, but he'd also just slouch to the side or the other side. And eventually you would see it. He'd start to droop and you'd see that dizziness coming in. So you want to check that. The last and final one is walking, and I don't recommend doing it if you've already noticed a major issue with walking. If you've already noticed it, don't risk them by getting them up and having them walk across the room. You've already seen what is going on. However, in my husband's case, we knew that he had vertigo where he was spinning, but we didn't necessarily connect it with the right side of his body until a lot longer. So he was falling to the right-hand side, having trouble gripping when he'd go to catch something on that side. But we didn't know it till later. Are you trying to like sit up and do stretching because you're so straight? No? Now you're relaxing?
Yeah.
So, what do you think was your biggest thing that people missed?
Right side going numb.
The right side going numb. When did that happen? Do you remember?
No.
No. See, it all happens really fast and really slow. The doctor's getting the diagnosis. That can be extremely slow. But the signs and symptoms, they just tend to show up very quickly, very strong. And you will be told by people, vertigo isn't a big deal. It's just a name they give for being dizzy. And there's not a diagnosis that goes along with everything with that. We were told millions of things trying to tell us not to worry. And that was before they found out it was a stroke. So it took me 2 hospitals, 12 hours, a lot of tears, 2 full-grown men to get him into the car, and people at the hospitals to get him out of the car, and a huge fight to get somebody to finally take this seriously. My best advice to you is just fight. Don't give up. Don't think you're stupid. Don't think you're wrong. Fight. Because in this case, in this scenario, it's been nothing but a fight for 5 months, has it? Mm-hmm. And if we had stopped at any point, we wouldn't be here.
Right.
You're staring at the screen. Mm-hmm. You are. You're staring so contently. What do you want to say? Anything else you want to say about watching out for signs and symptoms?
I can't think of anything.
Can't think of anything? How do you feel like you are doing now, 5 months later?
The only thing I'm doing a little better, especially on my right side.
Especially on your right side. How do you think we did together? Do you think it messed our marriage up or made it harder with the stroke?
It made it better.
You think it made it better?
I think so.
Well, that's nice. Aww. I think that you going through this, you really can't do it on your own. You have to be a team. And I know that's not always possible in so many situations, but in ours, there were days he wouldn't give up and there were days I wouldn't give up. And there were days both of us just were crazy strong that we don't even know how we got through. Mm. So there's more to the story. There's more information coming up about what to avoid once you have a diagnosis. This was mostly just like what to check to get a diagnosis. Now, we will have some more videos. We'll have a video kind of explaining the whole situation and how we got through that. and how he's doing now, and what we're doing to make life interesting, make life work. And some great ideas on how to get your loved one out of their comfort zone and using their hands and their body, games that you can play, things that you can do that will really get them moving again and get them using that that fine motor skill that they've kind of lost. And he's been a champ. You rock star? Yeah?
Yeah.
Yeah. All right. Well, what is your one piece of advice, if you can think of something to say to somebody else who has had a stroke like this?
Just keep swimming.
Just keep swimming. Okay. All right. Well, I am Lauren. I'm TJ. And you want to say goodbye and good night?
Goodbye. Thanks for watching.
Thanks for watching. Bye.